We heard earlier this week that President Biden was diagnosed with metastatic prostate cancer. This afternoon, we have Dr. Sarah Simmons, a urologist with ProMedica, with us to learn more about this type of cancer. We've all heard of prostate cancer. Many people don't know what it is. I'll let the doctor or the expert explain what exactly prostate cancer is.
So prostate cancer is a type of cancer that originates in the prostate, which is a gland in men that contributes to reproduction. It's actually a fairly common cancer, so it's the most common solid organ cancer in men. About 1 in 8 men in their lifetime will be diagnosed with prostate cancer.
Well, that's interesting because I think I was told by somebody a long time ago, if you're a man and you live long enough, you're going to get prostate cancer. It's a relief to know that's not true.
Yeah, the older you get, you have an increased risk of prostate cancer, so it's more commonly diagnosed in men that are older.
I know there's a lot of different ways of finding out. In your words, tell me what are ways to detect, or if you even need to have a test on that.
So most prostate cancers don't have any symptoms. So early on, there's usually no symptoms whatsoever. That's why we have screening tests. So the screening tests that exist are DRE, which is a rectal exam, where we can feel the prostate through the rectum. The other screening test is called a PSA, which is a blood test. So both of those, if there's anything abnormal, then we do further evaluation.
How long has a PSA test been around?
It's been around for quite a while. I would say more than 30 years. Yeah.
Because I know I'm very relieved to hear they had a PSA test instead of the old-fashioned way.
Yeah, yeah. We still do the old-fashioned way sometimes, but.
Degrees of solving the problem with prostate cancer. Talk about that some more.
So once a diagnosis has been made, a lot of the treatment is very individualized. So there are many prostate cancers that are slow growing and not aggressive. And in that case, we can do something called active surveillance, which is where we just check PSAs, do exams, sometimes do additional biopsies, just to make sure that the cancer isn't getting more aggressive.
Is radiation an option?
Yes, so in more aggressive prostate cancers, radiation or surgery are options. The surgery to remove a prostate for prostate cancer is called a radical prostatectomy, and that's done almost exclusively robotically now. It's been done robotically for quite a few years, and more recently there's been new innovations in surgical technology, so we can actually use something called a single port robot, which leads to better tolerance of surgery and quicker recoveries.
Is prostate cancer the kind of disease that you might get that there's ways to prevent it, whereas a lot of cancers are preventable by lifestyle choices? This probably doesn't categorize there, does it?
Not really. So there's not great data on how to prevent prostate cancer. We know about risk factors, which often are out of people's control. So the main risk factors are family history and race. We know that Black men have much higher rates of prostate cancer. It's more aggressive, and it often shows up earlier in life. The best data that we have is basically that living a healthy lifestyle can prevent prostate cancer, decrease your risk. So healthy diet, exercise, maintaining a healthy weight, those things.
Now, President Biden came down last week of the news with that, and it's pretty far along. He's only been out of office a few months, but as we talked earlier, it looks like he's had it for a while and it was not detected, and for some reason we don't know. We're not involved with that closely. But for it to be that far along with metastatic, it has to be something he's had for a few months or years.
Yeah, so I don't have firsthand knowledge of his case, obviously, but I've seen what he's disclosed. He said that he has prostate cancer that's metastatic to bone, which means that it's spread outside the prostate and has caused bone tumors as well. That's one of the most common places that prostate cancer spreads. It's hard to say if he was screened. There are, of course, rare cases where people are screened and it's not detected early. Usually a cancer such as his either has been present for a long time or it's abnormally aggressive.
Boy, the thing is, if you do detect it, you can start treating it early. It's not curtains for you if you get it detected early, but boy, if you wait too long, once it starts getting in your bones, then it's going to be a whole different problem.
Yeah, and it's not necessarily curtains for you in that situation either. There are definitely treatments that are effective and well tolerated for most people once they have metastatic disease.
Dr. Simmons, thanks so much for coming in and telling us more about prostate cancer. Appreciate your time.
Yeah, thank you for having me.